Hello, I'm Dr. Inman. I'm the frequency-specific low-level laser guy. Been at it for now 20 years, essentially. Developed about 6 or 7 different lasers for frequency-specific laser therapy. We deliver laser therapy that communicates to the mitochondrial DNA with specific frequencies, not wavelengths, specific frequencies that actually induce those tissues to do what they're supposed to do. This is a small and short video on kidney failure. Kidney failure is a big problem in dogs and cats, also people, but nonetheless in cats particularly, they'll go about anywhere from 15 to 19 years and all of a sudden their kidneys will wear out. The BUN creatinine goes up essentially, and when they do, the animal starts to lose weight and dump protein in the kidney because the kidney is not functioning. Now this is something we found out, that when kidney starts to fail, in other words, if it failed, the cat would die, but when it starts to fail, it's really getting a D. And so essentially what's happening is it's not effectively removing the byproducts of metabolism from the kidney, or from the blood in the kidney. The problem in the situation is such that in a condition where we're ending up with kidney failure, about a third of the kidney cells are gone. They're basically worn out. They're not going to be rehabilitatable. A third of them are functioning, essentially, otherwise the cat would die. And a third of them, essentially, are still viable, but they're just not functioning correctly. They're just not functioning. They're basically stunned, if you will. And what we're able to do with the kidney function protocols, and there's 3 of them, kidney dysfunction, kidney failure, and also kidney disease general, we're able to actually stimulate the tissues of the kidney, the proximal convoluted tubules of the kidney, to do what they're supposed to do, to actually engage them. And so if we have an adequate amount of kidney tissue available to be rehabilitated, we can basically go back from about 33% of functioning kidney, which is going to be clinically in kidney failure, back to about anywhere from 50 to 60%, which basically is essentially a normal cat. They gain weight again, and they live another 4 or 5 or 6 years sometimes, essentially, and that's something that we're able to do. The frequencies essentially are in their 16 different frequencies that are involved in increasing the blood supply, lymphatic drainage, and stimulating those proximal convoluted tubule kidney cells directly to do exactly what they're supposed to do. And the therapy isn't any more complicated than this for 60 seconds. We treat them twice a day for 3 days, once a day for 3 days, twice a week for 2 weeks, and at that point, at 3 weeks, then we retest their blood, making sure that their BUN and creatinine are changing. Now, a lot of times it'll go up before it'll come back down again, and we continue that type of therapy, and the animal will pick up in its appetite and also gain some weight. So that's one of the ways that we evaluate kidney failure as it's seen in the kitty cat. Giving the cat parenteral fluids, essentially, as a lot of times people will do in an old cat like this, may not be necessary during this period of time, but hydration needs to be kept track of quite effectively to make sure that we're not getting a dehydrated cat where the kidneys will have to do more work than they really actually should. So this is how we treat chronic interstitial nephritis. Chronic interstitial nephritis is also treated with these 3 kidney protocols that we have in this laser. This laser has 1,800 different protocols, thousands of different applications essentially, and it's the device that we use now. It's about a third the cost of the device we used to use, and it is hundreds of times more effective. We will use this at approximately 225 to 375 milliwatts essentially for about 60 seconds, and we can be this far away if we want. In this regard, we don't have to wear glasses at this particular power level, and the success rate is delightfully higher than we thought that they would be. I would say probably 60 to 75% of these animals will respond, indicating there's a lot of animals that are wearing out their kidneys that are rehabilitatable with this instrument. We should try this. Like I say, inside of 3 weeks to 4 weeks, we'll know whether or not we're going to win with this technology. If we get the kidneys up and running and the animal gains weight and has normal BUN and creatinine, which, by the way, the BUN may not ever come back down into normal range, but be high for the rest of the animal's life. But if we get the kitty cat to live happily ever after, and also the dog and the horse, then what we have is a condition where we can laser them every 6 months or so and get the same kind of response. By lasering them, we'll laser them 2 or 3, maybe 4 times essentially. And that's all we need every 6 months. And they keep going and going. Cats are incredibly tough. And if we can get their kidneys to function and do what they're supposed to do, we're probably going to win. But this is the technique that we use for kidney failure in the kitty cat, and also in the dog, horse, and sometimes in the human, essentially. So thank you for listening to this miniature lecture on kidney failure, specifically for cats. But and I appreciate it. If you have any questions about this technology and its application, please feel free to contact me at drbill@vomtech.com. That's drbill@vomtech.com, or contact me via phone at area code 208-640-3430. That's 208-640-3430. Thank you, and have a great day.